Welcome back to the show. Thank you, Dr. Anthes, for enlightening us about preventing the cancer and telling us information about the vaccines which can prevent the cancer. How about people older than 14 years of age? Where can they get the vaccine, and what should be the dose of vaccine for them?
Right. So the vaccine is given, as I mentioned, to those in grade 7. So for those who are 13 years of age, it's generally 2 vaccines that are given 6 months apart. Whereas for those that are older, 14 years and older, or for immunocompromised patients, they get 3 vaccines over the same 6-month period of
So
time.
these vaccines are only for human papillomavirus, HPV virus vaccine. There are no vaccines available for other type of viruses, or are they available?
Right. There are vaccines for hepatitis.
Hepatitis virus, yes.
Hepatitis, but there are no vaccines for HIV
HIV
viruses.
virus, right. So more information they can get from the Thunder District Health Unit. People can contact and get more information.
Right. If parents or young people have questions, they can contact the health unit.
Yes. And I think it's very useful all of us get vaccinated and at least prevent one type of cancer, which is HPV and hepatitis virus, which can cause cancer probably.
Yes, I think it's very important, and I think parents should have their children vaccinated.
All the children, all the adults should get vaccinated for HPV and hepatitis at least.
Well, the problem with adults being vaccinated for HPV is that many adults already have the infection, and the vaccine is not useful. So it's really useful for our young people before they become exposed to HPV.
Correct.
Correct.
Now, can you please tell us about some screening methods which can help us to detect the cancer earlier?
Right. So screening methods, it depends on the type of cancer. We all know that mammograms are recommended for women. In Canada, it's recommended that mammograms be started at the age of 50.
50, yes.
Yes, generally on a yearly basis, although we know in the United States, they often start mammograms at the age of 40.
Oh, very earlier.
Yes, but it does depend on risk factors.
Right.
As far as family history and previous family members with breast cancer regarding the screening. Often what we recommend is to start mammograms 10 years before a first-degree relative. There are other cancers that can be screened for.
Like colon cancer can be screened?
Right. So with fecal occult blood testing would be the first way to start screening for colon cancer.
Yes.
And then if that's positive, or patient has other risk factors, to move on to sigmoidoscopies, which is taking a look into the lower part of the bowel, or colonoscopies.
Right. And cervical cancer can also be screened by cervical smear testing,
Right, pap smears.
Pap smear testing.
And pap smears are generally recommended starting at the age of 21.
Right.
With screening done every 3 years.
And it can detect the cancer at very early age, and we can treat it, and patient can be cured with earlier detection.
That's exactly it. The idea is to find these cancers early and to treat them at a very early stage and hopefully improve chances of cure.
And man over the 40 or 50 years of age can get PSA done for the prostate cancer?
Yes, and that's very important to have the PSA testing.
Just a blood test, right?
It's just a blood test.
And you go to the lab and you know if the numbers are up?
Right. So if the numbers are elevated, it may prompt your doctor to do further investigations.
So what do they do to diagnose the cancer? Once the screening test comes positive, what are the further investigations a patient has to undergo?
Right. So just because a patient has an abnormal screen or even signs or symptoms of a cancer, that's not enough to diagnose the cancer.
Yes.
The diagnostic test really is a biopsy.
Biopsy procedure. So they take out the tissue from the body?
Right. It's taking a piece of the tissue and sending it to a lab to be analyzed by somebody such as yourself, a pathologist. A pathologist, being a doctor who diagnoses diseases such as cancer.
And then after biopsy comes, then what is the next step for them?
Right. So I guess we have to look at what does the pathologist tell us. The pathologist tells us the type of cancer, where the cancer has come from, and gives us further information regarding the growth of the cancer, things like that. After the cancer has been established, Further tests are done to determine the extent of the
Extent
cancer.
like CT scan, MRI.
Right. So we have to determine if the cancer has spread or if the cancer is a localized process.
Right.
So the patient gets the appropriate treatment.
Right. So that's where the staging will take place, and then
Right.
that will help to determine the treatment.
Right.
So what are the treatment options for the patients at this time?
Right. So really, how can cancer be treated? The three main ways to treat cancer that we think about are surgery, radiation, and chemotherapy.
Right.
But there are other ways too.
Yes.
And
So
we can touch
some
on those.
patients say that the cancer treatment is worse than the cancer itself. Is that true?
No, that is not true. That is a concern when patients come in with a preconceived idea that they don't want to have treatment.
Right.
Often patients have minimal symptoms because the tumors are so small that they really don't cause symptoms, and they're quite surprised by this. But it's important that the patient understands the disease process that they have, the options available, and understands that this can translate into cure and a normal life expectancy
Yes.
if they have the treatment that they need.
So treatment is not worse than the cancer itself. Treatment can cure patients. So patients
Treatment
should
can
opt
cure
for the cancer.
patients, but treatment can also cause side effects.
Side effects, yes. Can you please tell us something about side effects of the chemotherapy, radiotherapy?
Right. Okay, well, as we know, chemotherapy is drug treatment given intravenously to travel to tumors through the bloodstream.
Right.
And chemotherapy, like radiation, can cause acute side effects and long-term side effects. So there are the immediate side effects, and there are late side effects. Common side effects that we all know about: nausea. That's
Yes.
a big one.
Right.
But we do have drugs that help with nausea significantly.
Yes. Yes.
In this day and age. Patients often have loss of appetite, hair
Yes.
loss.
Hair loss, yes.
Yes.
That I've seen many times.
Right. Oftentimes hair will regrow
Yes.
after cancer treatment. Patients can develop sores in their mouths or along mucous membranes, diarrhea. These are other things.
Common side effects. So patients should not get scared with the side effects because there are treatment available for those side effects.
Right. There's always treatment available for the side effects, and side effects often get better,
Right.
although there are some that stay. One of the acute side effects is lowering the immune system by damaging the blood-making cells.
Okay. Right.
And when this happens, patients have higher risk of infections.
Right. Can you please tell us about the new modality of treatments available, like targeted therapy we hear about, and immunotherapy and hormonal therapy available? So can you please tell us what is difference between chemotherapy and targeted therapy?
Right. Targeted therapy works by targeting specific genes or proteins, either in the cancer cells or in cells that are related to tumor growth or cancer growth. Oftentimes, this targeted therapy is given in conjunction with chemotherapy to make it more effective.
So all this modern treatment, targeted therapy, immunotherapy, hormone therapy, they are very specific to each type of cancer.
Right.
And they increase the survival of the patients with the cancer.
Right. So immunotherapy will boost the body's immune system to help fight certain cancers. And as you mentioned, hormone therapy is also used for certain types of cancer. What comes to mind most commonly is breast cancer,
correct.
and prostate cancer.
Correct.
And hormones travel, are made by glands in our bodies and travel to these to various locations where they have an effect. And if you block the hormones, or if you give a hormone that will block a receptor on a cell, it will
stop the growth of
the growth of the cell.
That's good.
Shrink the tumor, and sometimes they're very, very effective with minimal side effects.
Thank you, Dr. Anthes. That was very, very useful information, and I'm sure all the viewers will get benefit out of this. Thank you for watching the show Talk with Your Doc. In our next show, we are going to talk about a variety of different cancers, including prostate cancer, colon cancer, lung cancer, and variety of specialists will be here on the show. Thank you so much for watching the show Talk with Your Doc. Thank you. Thank you, Dr. Anthes.
You're welcome.